Bismillahirrahmanirrahim. Hello everybody. So here we have a 22-year-old woman come to the emergency department due to a 4 hour of severe lower abdominal cramping and heavy vaginal bleeding with passage of large clots. The patient pain subsided after the passage of a round pale mass which while she was at home. Her bleeding currently is a heavy as a normal period and she reports some mild lower abdominal discomfort. She has no fever, chills, or abnormal vaginal discharge. Her last menstrual period was 7 weeks ago. The patient has a history of intermittent cocaine use, abuse, and smoke a pack of cigarette daily. Temperature is 37, blood pressure is 120/70, pulse is 90 per minute, and aspiration are 16 per minute. Abdominal examination show mild tenderness over bilateral lower quadrants and no palpable masses or rigidity. Pelvic examination show a closed cervix and a small amount of blood pool at vaginal vault. Urine beta HCG is positive. Transvaginal ultrasound revealed a normal uterus with an empty endometrial cavity, no adnexal masses, and a scant free fluid is in the posterior cul-de-sac. Which of the following is the most likely diagnosis? Abruptio placenta, complete abortion, ectopic pregnancy, hydatiform mole, inevitable abortion, normal pregnancy, subchronic hematoma, threatened abortion. So first of all, this patient come to us at less than 20 week of gestation. Less than 20 week of gestation. This is the first hint. This is the first hint. The second hint is she having severe lower abdominal pain, cramping, and bleeding from the last 4 hours. The third hint, she experiencing passage of large clot. The fourth hint, passage of large clots, and she having the heavy bleeding as a normal period, and she report normal lower abdominal discomfort. Are normal abnormal, and she didn't having abnormal vaginal discharge. Her last menstrual period, as I already explained here, that she come to us at less than 20 week of gestation, and the patient used intermittent cocaine abuse, and a pack of cigarette daily. Fifth hint, on pelvic examination, she having closed cervix, on 6, beta ECG is still positive. Beta ECG is positive, and ultrasound revealed a normal uterus with an empty abdominal cavity, no adnexal masses. So what is the diagnosis of this question? First of all, this patient come to us at less than 20 week of gestation. First. Second, she having severe lower abdominal cramping with heavy bleeding as like normal period from the last 4 hours. Third, she experienced passage of large clots. She abused cocaine and pack of cigarette daily. On pelvic examination, she having a closed cervix and the beta HCG is positive. So this is complete abortion. Complete abortion. The diagnosis of this question is complete abortion. And here the correct option is choice B, complete abortion. So I will explain to you that what is complete abortion. A complete abortion, a type of spontaneous abortion, typically present as lower abdominal pain and heavy vaginal bleeding with the passage of clots at less than 20 weeks of gestation. These symptoms worsen until the product of conception, often described as a solid or sac-like bloody white mass, are expelled and the symptom lessen and resolve. Pelvic examination finding include a normal size uterus and a closed cervix. Ultrasonography reveal an empty uterus and a normal adnexa. A positive beta HCG is common in patients who present with a complete abortion, as it can take up to 6 weeks for beta HCG level to become undetectable. So the choice B is the correct one. Now come to the incorrect one, abruptio placenta. So as we already know that abruptio placenta is the premature separation of the placenta from the uterus, which is a cause of painful vaginal bleeding at more than 20 weeks of gestation. Choice C, ectopic pregnancy. So in ectopic pregnancy, the pain is typically unilateral and the bleeding is commonly light. Choice D, hydatidiform mole. So in a hydatidiform mole, the ultrasound revealed a heterogeneous uterine cystic mass with a snowstorm appearance. Choice E, inevitable abortion. Inevitable abortion present with vaginal bleeding, lower abdominal pain, and a dilated cervix. F, normal pregnancy. So although some pain and or bleeding can occur even with a normal pregnancy, ultrasound of such a pregnancy will reveal a normal fetal heartbeat. Choice G, subchronic hematoma. So threatened abortion often have an associated subchronic hematoma and abnormal, which is an abnormal collection of blood between the placenta and the uterus. Choice H, threatened abortion. So a threatened abortion also present with pain, bleeding, and a closed cervix at less than 20 weeks of gestation. Now come again to the choice B. Why the choice B is the correct one, I will explain to you. Because this patient came to us at less than 20 weeks of gestation. Second, she abused cocaine and a pack of cigarette daily. From the last 4 hours, she having severe lower abdominal cramping and bleeding, and she experienced passage of a large clot. On pelvic examination, she having closed cervix and the beta ECG is positive. So the diagnosis of this question is complete abortion, and here the choice B is the correct one. Thank you.